Now let's talk about the R2Gate report and drilling sequence. With each R2Gate case you do with your R2Gate center, they should send you an R2Gate 3D diagnostic report. And now I'll talk to you about how we can read and use the R2 report. In the R2 report, at the top you'll find information about the patient, you'll find information about the operation site, you'll find information about your name as a dentist, you'll also find information about the type of restoration that is going to be delivered in case you do OneDay implants, and who is the designer and who is the person that did the planning and the design of the surgical guide and the restoration for your case. You'll also find information about the site of the implant that is going to be placed, the type of implant that is going to be placed, and also the size of the implant. In this case, we're placing a 4.0 millimeter implant by 8.5. The bone density information in this site, based on the bone density analysis that is done using the digital eye, shows that this is a D3 type of bone. Also in the report, you'll find number 1, a 3D view image, number 2, a cross-sectional image, and an image with digital eye. You'll also find information about the drilling protocol. So in this case, for instance, we're going to be drilling using the initial and second drill, the 2.0, 2.5, 3.3 millimeter implant, and then cortical bone drill 3805. You'll also find markings. Some of these markings look like a circle, some others look like half a circle, and some look like an exclamation mark. A full circle means full depth drilling. That means that I will take my drill and I'll go all the way down to the end of my osteotomy until my drill stopper touches the surgical guide and it stops in the guide. Half depth drilling means if I'm using an implant that is shorter than 10 millimeters, the recommendation is to use that short cortical bone drill, which is only 5 millimeters, all the way down. If I'm using an implant that is 10 millimeters or longer, it is recommended to use the 7 millimeter drill and go all the way down until the end of the osteotomy. Exclamation mark means that this drill is optional. So based on what you see at the time of the surgery and your clinical sense, then it will be advised to use or not to use that particular drill.